Lahey Hospital and Medical Center is much more than an inpatient-outpatient medical facility. Medical research is a critical component of what Beth Israel Lahey Health has to offer.
So at Lahey, we have 3 different types of research. The first one is clinical trials, in which we're looking at different treatments or different devices or behavioral differences in patients. And then the second is translational research, which is what they call bench to bedside research, in which we start with a clinical question, we look at things in the lab, and then we hope to bring that back to patients in an intervention or a biomarker, a way to be able to detect something. And then third is our outcomes research, in which we have the comparative effectiveness Research Institute. So what we're doing is really looking at different outcomes for similar treatments. We do a lot of clinical trials for oncology, which is great. Patients don't have to go downtown to get those types of treatment, and really for oncology patients, sometimes that's their last hope, to have that type of research for them and a trial and intervention that they may not otherwise have. We received a $4 million grant from the Massachusetts Life Center, and with that we are making image-guided therapy center. And part of that is this team makes molds of people's brains and skulls, and they can put in aneurysms in there. And then what we do is we use those 3D molds, and we can use different instrumentation to see if we can find different ways and different types of instruments to actually go in and retrieve the aneurysm and help with the healing of that. And again, that's translational research, right? Here's the question about the aneurysm, and then we bring it to the lab and we work on it in the lab with the hope that we can then, when we have new instrumentation or new ideas of how to get somewhere that we couldn't normally get to, and then we can bring that as a clinical trial to patients. What we want patients to know is that many of the interventions and the drugs and all of the devices and treatments actually started with research, and that's occurring here at Lahey. And some of it is, just not necessarily looking at a treatment or biomarkers, but actually looking at data and quality of life and asking patients, how did you feel after this? So that we can really look and see, did treatment A or B, is that better for patients? And more specifically with precision medicine, is it better for you as a patient as opposed to someone else? Research at Lahey is growing, and one of the areas that we are moving towards is what's called a learning health system. And what we want is engagement from patients in that. So we want to know from the patients, what do you want us to be looking at? But the idea is really to bring all of that back to make treatment and outcomes better for patients.
From Lahey Hospital and Medical Center, I'm BNEWS reporter Tad Stefanak.